Good evening, all. I'd like to open the Board of Health meeting of Monday, August 2nd, 2022. Let's see, we have no appointments scheduled. Got a couple of action items. The first on disposal work permits. We have 535 Winter Street, 100 Plymouth Street.
1,000, actually.
I'm sorry, 1,000, thank you. 1,000 Plymouth Street, 548 Summer Street, 126 Franklin Street, and that's pending.
Yeah, I'm sorry about my messy writing. Pending conservation, there's a lot of stormwater issues on that property, so the...
When's Conservation going to hear that, you know?
They don't have a date yet. So typically with septic system approvals, the septic system meets all of the Title V and septic requirements. So we wouldn't release the plant, we wouldn't allow them to start the project until conservation has given them a permit.
Okay.
But our approval has nothing to do with
No,
conservation's.
no, it was
approval.
just
Okay.
collaboration.
Yep.
Okay, so I'll accept a motion to accept the disposal work permits.
Motion?
Seconded.
Okay, we have a motion, Lisa, second Matt. Any discussions? Hearing none, all in favor?
Aye.
Aye, so that passes unanimously. Okay, we have no installer permits, so we do have some invoices, Sue?
Yep, so they're all listed here, so I'll give you a rundown quick. Bucher and Sons, we have an invoice for the entire month of July, and that's for all of our septic services. That's for $3,300. Robert Casper is $850, and that is from June 14th through July 16th, routine inspections. I believe there was one additional inspection in there as a result of that fire at Gold's Gym.
Mm-hmm.
B&D Associates for a syringe pickup, $185, and WB Mason for office supplies, $108.61.
I'll make a motion to accept.
Second.
Okay, so we have a motion, Matt, second Lisa. Any discussion? All in favor?
Aye.
Aye, passes unanimously. Body art permit.
So this is one that was on our agenda a few weeks ago, but we took it off because it was missing
Mhm.
some items. So Giovanni Lang is going to be a body art practitioner at Sacred Edition. He did get in the documentation from CBS that I've been waiting for. So at this moment, his application is complete, and this is your first go-around probably with body art. When they're licensed, it's for a specific location, so that doesn't mean he can do tattoos all over East Bridgewater. It's only at Sacred Edition Tattoo.
Motion to accept?
Okay, we have a motion, Lisa.
Seconded.
Second, Matt. Any discussion? Hearing none. All in favor?
Aye.
Aye. It passes. And then we have a food service permit for TJ Smith's.
Yeah, so TJ Smith's, I mean, always gets a food service permit, but some of you may know that they never reopened after the shutdown. They rented out their facility to the schools for
Mhm.
extra classroom space. So they're finally ready to start having weddings again.
Gotcha.
So it's a renewal for them, just a little late in the year. And I did talk to Rob Casper, because they've been closed so long, they really need to have a reopening inspection. So he is going to arrange to get out there this week before the wedding. You know, he's not concerned. They're you know, they've been in business for a long time. But he'll go out just to make sure everything looks good.
Motion to accept?
Okay, we have a motion, Lisa.
Seconded.
Second, Matt. Any discussions? Hearing none. All in favor?
Aye.
Aye.
Aye, it passes unanimously. Okay, last couple of items. Office updates.
It's probably all just gonna blur into one here. I sent you an email today about Sachem Nursing Home.
Mhm.
Everyone got that?
Yep.
Mhm.
The blower connection has already started. He made the muffler today for the pipe to quiet down the noise. For the viewers at home, Sachem, the abutters at Sachem have had an issue with odor for years, coming from the treatment in the treatment system.
Right.
So they've come up with what's called an air scrubber system. They put the fan on this week to test it, to make sure the neighbors wouldn't be too disturbed by the noise. One of the neighbors did find the noise to be slightly intolerable, so after having a conference call, and Matt was actually present with the operator, he's gonna make a muffler, plant some arborvitaes, and extend the pipe a little bit away from the abutter's home. And once it's actually connected, the noise will automatically go down a bit anyway. The abutters were all in agreement. The state's already issued the permit. It's really not our permit to issue. We're just kind
Right.
of working with the abutters as a middleman. And they've already started, so hopefully that'll get wrapped up this week.
So does the fan run continuously or just when it, okay.
It's in the shed back, so it does run continuously. So that was Sachem. As far as mosquitoes go, we're currently at a moderate risk in East Bridgewater for West Nile virus. That would mean that some of our surrounding communities probably had some samples that came back positive, no human cases yet. If there was a human case or they changed that, we'd get alerted via text message and phone call, to tell us what our new risk level is and to tell us to talk about what we're gonna do about it. So, and last year we had no problem, but in the past, you probably all know we've had, to shut down things at dark when it got pretty bad. And then COVID is picking up. We have now 36 cases in the last 2 weeks, as opposed to 6 cases the previous 2 weeks. We can't tell by looking at our information what variant they are. That's not information the state provides to us. But we do have certainly an uptick in cases. Some of the people have been vaccinated.
So do we know what percent of the cases are people who are vaccinated versus unvaccinated?
I would say right now it's probably somewhere around 35%.
Okay, so 35% of these 36 cases
Yeah.
are people who are
Yep,
not
and-
vaccinated.
No, are vaccinated.
Are vaccinated.
Yeah. All the vaccinations, so that brings me to another problem. It could be more, it could be less, because Heather is having a big problem with people answering and returning phone calls. So if you're out there and you've been tested for COVID and you're positive, you're gonna be contacted by the Board of Health or the Contact Tracing Collaborative, and Heather does call from a cell phone, a town-issued cell phone. I'm not sure if the caller ID comes up as East Bridgewater or not, but if you have a message from Heather Dissett, she is our nurse, if you could call her back, appreciate it. So that number, this is based on the information Heather's obtained so far. She still has a lot of people that I looked at her notes today, and there's a lot of voicemails out there that she's waiting for people to return calls to her.
So is there a timeline before a second phone call, or is there?
Oh, she she calls every day. She'll call, if you look at her notes, it'll say voicemail, 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 and, you're not required to pick up. It's, just something that it's helpful to us if we get a little more information from you, and to make sure you have the appropriate quarantining and isolation guidance.
Do we know if there's any concentration, whether it's youth or camp or
It's all over the map.
all over the map?
All over the
Okay.
map, yeah.
All right. Did you know how that compares to some of the other towns?
Well, I looked quickly today. West Bridgewater only has maybe half a dozen. I don't have access to their real numbers. I just have access to the same report the rest of the world
Right.
does on their biweekly reports. So I did confirm that with their health agent this morning. I don't think it's such a bad thing that our number is high. It means that our residents are being responsible in getting tested if they don't feel well. So I look at it kind of as a positive thing, that the people that are positive had some symptoms and got tested, and they're staying home, so.
Well, I think there's going to be somewhat of an uptick anyway,
There is.
where they have to be tested to go back to school.
Yes.
That type of
Yep.
thing. So we're going to see a little bit of a rise.
We are, yep. We are, and we, not everybody is seriously ill, you know, so that's also good news.
Well, that would be an indicator that they're vaccinated, right?
Not
Not
necessarily.
necessarily, no, you know, I mean, we have, all along, we've had some, you know, there's really no rhyme or reason to it. We have some people that get very sick, and we have other people that you think, oh my gosh, this person's got underlying illnesses, they're gonna be very sick, and they have a sniffle. So there's really no rhyme or reason to it. It's kind of funny how it pans out.
Okay.
But I can, if you'd like more information for the next meeting, I can certainly ask Heather if she can kind of do obviously we can't give out specifics, but if she can do kind of a breakdown when she gets a hold of, a decent amount of people to see where we are as far as percentages and vaccinated, unvaccinated.
Okay. What else?
Then the other thing I have that, under the topic not reasonably anticipated, is I emailed you all over vacation about, we have a housing order that we issued. The landlord, who's the subject of the order, has requested a hearing. When you issue an order, you have to give them 7 days to request a hearing, which he did. So we need to set up a hearing date that we can, let the landlord and the tenant know about so that they could come. I did talk to Chris Kenny. He said whenever the hearing is, he'll come in advance of that to kind of go over the layout of what the hearing will, look like and what to expect.
So would our next regular scheduled meeting be acceptable? Or
It
is
would. I
it
mean,
last day?
I have some reservations myself about having it televised.
Well, we can,
I don't know, because there's gonna be some sensitive discussions, I'm sure, if everybody shows up. And Matt was actually there on site with me for, one of the inspections, so, I don't know, what are your thoughts, Matt?
My thoughts on this are very similar to my thoughts on how we handle housing complaints in general,
Yeah.
where we try to keep as much of that information.
Private. I mean, it's
As
still,
much of the private
It's still
information-
an open meeting. If somebody chooses to come,
Yes.
that's fine.
We don't have to offer it out to everybody the way we offer out.
Septic systems
Septic
and
systems.
stuff, yeah.
This is where someone lives, this is someone's.
Yeah,
Yeah.
yeah. And, they have jobs and,
Yeah.
stuff.
So do the people involved have a time issue? Like, are they working 9 to 5 or?
No, I do not believe there's any time issue for, the landlord is a business owner, but he pops in here during the day all the time, so I would lead me to believe that he's available during the day, and the tenant has a schedule during the summer that does allow her, I believe.
So can we meet before our next scheduled meeting? Can you come earlier?
We just want to have enough time to, obviously get them the date, to make arrangements, but also to make sure that we get Chris Kenny, our town council, to
Yeah.
make sure honestly, I've been working for the town since 1998, and we've never had a
Do we have any legal?
housing order.
Do we have any legal obligations as to when the meeting has to be scheduled in regards to when the notice was given?
When you read the notice for hearing, it just says they have to request it within 7 days. Now,
But
obviously.
once that happens, it's
Yeah,
open up.
obviously, we don't want to let it go on too long, because one of my orders indicated that they needed to have a
Excuse me.
smoke alarm and fire alarm put up, which is, a safety
Safety
issue.
issue.
And there is a wet carpet in the basement, so.
I don't have my calendar with me. So what's our next schedule?
Our next is the 16th, but that's the one Matt won't be
I will not be at.
attending because of
Okay,
vacation.
so let's move that.
His 20 weeks vacation.
So much trouble. Haven't gone on vacation at all.
Okay, so you're out the 16th.
I'm back the 17th, believe it or not.
Okay, then,
But yeah, it doesn't have to be a Monday, I mean, it could be.
Can
a
we
different
shoot
day of
for
the week.
Wednesday, the 18th? Is everyone?
Let's see.
I can do any time.
I'm okay, so that's
Yeah.
whatever you guys need.
I can make Wednesday the 18th work as long as I can get my son to his doctor's appointment, which is in late morning, so.
And I believe just in some other past interactions with the tenant, the later in the morning or early afternoon is probably the best.
Early afternoon would be
Time.
perfect for me.
Define early afternoon. 1 o'clock?
That's my appointment.
What about you, will you be
Four?
sleeping?
No, I can do any time that Wednesday.
What are we saying?
What time do you?
I have a doctor's appointment with my son, so it'd be 11 to.
Anytime on the 18th is fine with me, I'm here all day. so-
Want to do it at 3? Is that too late, you think? See what they say?
I think that might be good. Toward the
Okay,
end of
so
the day.
3 o'clock on the 18th.
Yeah.
We'll do that upstairs.
Probably should have a little more space than that.
We can do it here, we just aren't going to televise it, right?
Yeah, we can still do it down here. I think we want to make sure that tenant and landlord have enough
Distance.
Okay.
I just think that's a small space, you know, and.
It is a small space,
Yeah.
but that statement makes me concerned.
Well,
What's the-
if I'm gonna, you know, I just, it's not, there's no love lost, you know, and there's definitely a lot of anger. So I just want to make sure, you know, that we're not.
We don't need a
not in each
detail.
other. I think there's.
That was my next question, is that the next step?
Yeah, I might consider it, but I think, you know, more importantly, I just want to make sure everybody feels comfortable and not like, you know,
Mhm. Oh, yeah.
you know, and when it's just us, you know, and especially, and honestly, you know, now that we do have a little bit of a COVID resurgence, it's probably not a bad idea to have, you know, 6 feet between all of us. so. Okay. So I'll just
All
have
right, so
Rebecca
3 o'clock,
slap
the
this one for us.
18th.
Downstairs.
Lee or whoever is in charge of that. They're probably watching right now. And I think the other thing is I did make copies of resumes that came in for the health agent position, and that's really not for me to discuss, so.
Okay, so you're all set with all the other issues?
I think, unless you have something you can think of that I'm supposed to update you on, but I think.
All right, so now we'll move on to the health agent position. So we've gotten some resumes that Sue sent out, and then some more came in the end of last week, is that correct? Sue?
Yes, so
Okay.
you're the only person that's got, I was directed to give them to the chairman. so-
Gotcha, okay. So, what I'd like to do is I plan on taking whatever came in, what we have, and then what you came in, and doing a phone screen. So the initial pass is that unless somebody came in with that last set of applications or resumes, if any of them had soil.
Nobody has any
Nobody-
septic,
nobody
soil,
has soil or
construction,
septic.
of anything of the sort.
So the next step would be, is I was gonna go through and just do a quick phone screen. And then come back and rank these how I see them, and then we can disseminate them, get feedback. But it leaves us with, so part of the phone screen is going through and actually finding out if anybody wants to obtain their soil. So somebody in that scenario would move up to the top of the rank, you know, again, depending on the other qualifications and what the individual is looking to do, past experience, so on and so forth. So
Now-
that may put us in a position where we have 10 applicants and nobody has soil.
We are already in that position.
Well, we
where
are.
We have a number of
Yep.
applicants and nobody has soil, and we don't have to hire from this batch of applicants.
No.
We can choose to restructure the
And
process.
that would be the next step, is if we
Rather
do
than
not
hire
have.
someone from these batches
Yeah.
that do not fill
Great line.
the one thing we need.
Right, agreed, but
And-
we need to go through and
Decipher.
go through these anyway, and make sure that we don't have anybody. And then if we don't have anybody.
Okay.
Then we can take the next step and look to see if restructuring is the best course of action.
Now, soil certification would be something that we would pay for them to get, or would that be their responsibility?
That's something that we can discuss ourselves, whether or not we want to do that or offer a subsidy,
Okay.
you know, split the.
And then do we
split
know
the
how
fee.
long soil certification takes?
The first class is not even available till spring of 2022. It's a several-week course. And
How many
then I
courses
would-
are
Then they
required?
would also need quite a bit of experience before you could entrust them to go out and do some of this job.
Sue, how many courses are required to be,
It's a soil, it's a soil evaluated class. It's a one, but it's a several
Just a
week.
one class,
yeah,
several week
it's
class.
Probably like 12 weeks or something like
and
that.
they haven't had it in 2 years? So would it be safe to say that there's probably a line of applicants?
There is a waiting list right now.
Waiting list right now. Okay.
Is it where is it offered in one?
Yeah, it's the state that offers it. It's,
So would we have the ability to access or post on their page or access their graduates to target them?
it's already been shared on the MHOA, on the
has.
the Mass Mutual Association, is that MMA, Mass Mutual Association, yeah.
I would assume we're not the only town
So,
looking
no,
for
if you
someone.
look at the MMA and the MHOA websites and you search health departments, there's a lot of openings. And I think a lot of those vacancies came during the pandemic probably. But, when we posted the job, I got a call immediately from another health agent saying, good luck, there's a million vacancies, and unless it's a big money town, you're gonna have trouble. And I think, if you look quick, you'll see there's health inspector, health agent, health director, there's a ton of them. It's a tough, we went through a lot this year, and I think it was a lot for a lot of people.
So when's our next scheduled?
16.
Well,
No,
if we're gonna meet, we might
okay,
as
are
well
we
just
doing
move
the
it-
16th
we might as
and the
well just do
18th?
then. if
We're
we're
just
Oh,
gonna-
we're
moving
gonna
everything
cancel
to
the
the, we're gonna
16th,
move
okay.
everything to the 18th. Okay.
Oh, is that what we want to have a meeting the 18th and that hearing? Is that what we're thinking about?
Yeah, we might as well.
Yeah,
if
might as
we're
well,
gonna
that's fine.
post
Yeah, I just wanted to make sure
anyway,
I knew what was going on.
Instead of doing it
Yep.
twice.
Yeah.
So if I can get the phone screenings done by Friday, I don't think we need to have a meeting. I can get you my thoughts.
To be honest with you, I'm gonna stay 100% out of the process, because
Well, what
we're gonna disagree probably on the whole process, so I'm
Sure.
gonna let you guys handle it on your own and.
But
Yeah.
right, but I still need you to be the communicator.
Well, I don't wanna do the phone interview, I'm not gonna.
No,
do
no,
the
no,
phone
no, no,
interview.
no, no,
Yeah,
no, I'm gonna handle
yeah,
that.
Yeah,
And then after we'll put some of these, give some order to these, some rank and order, and then have you disseminate that to the entire board, and then maybe we can schedule something to come in and just go through the resumes.
so I'll have to double check with Rebecca, because when we hired the nurse, the other members couldn't see your rankings. Everyone had to do their own separate ranking, so you have to use like a sticky note. Isn't that how it was, Lisa? We had to use
Yeah.
like a sticky note to put your ranking, or somehow keep it to yourself, and then, because until you're under a public hearing or a public meeting process, you can't all see each other's
Okay.
opinions.
So I
That would be
believe
communication between
I think
meetings.
we need
how
that.
it would work is that you would review the applications, and then they would be asked to come in to interview, and then we rank them at their interview.
I can certainly check before you
Okay.
leave, because I do have 3 copies, so I
Oh,
can
that's
ask
how
her
it
if I'm
was.
permitted to give all 3 of you a copy to look at separately, as long as you don't concur, but
So
I
where
will
did,
check with her.
that information came from Rebecca?
That was when we were when we hired Heather.
That was the last person.
Yeah,
we had
so
to hire.
you couldn't discuss it, you couldn't see each other's notes. You could each just rank them yourselves, and then at the end, we could kind of collaborate them to see, okay, Matt and Lisa both put this person as number 1.
Okay.
But before you leave today, I will double check on that, when we've got everything, when you guys are signing, I'll go run over and check with Rebecca to see what the process is.
Okay. So I'll have the phone screens done by Friday, which is what, August 6th?
Yes.
Oh, soil. Okay. Anything else?
Nope. Not that I can think of, I just got back this morning, so Still playing catch up, but,
How was your vacation?
huh?
How was your vacation?
Don't ask. I'd like to say the phones were quiet and the email was quiet, but we had a lot of things happen, but hopefully we'll get somebody on board soon and I can actually take a real vacation.
Could you give us the amount of money we have spent on Rob Bucher since we signed a contract with him?
Sure.
You might as well do the same thing with Rob, like, per year for Rob Casper.
Yeah, so, yeah.
Per year.
Yeah. You can average it out, whatever, it's something thinking outside the box.
We can do that.
Anything else? Going once? Going twice? Okay. I'll entertain a motion to close our meeting Monday, August 2nd.
Motion?
Motion
Seconded.
Lisa, second Matt. Any discussion? Hearing none, all in favor, say aye.
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 Passes unanimously, and that concludes our meeting for Monday, August 2nd. Thank you, everybody.